Today we are going to talk about the CORALYS registry, which studies the incidence and predictors of heart failure after acute coronary syndrome. Previous studies investigating predictors of heart failure after acute coronary syndrome were mostly conducted during fibrinolytic era or restricted to baseline characteristics and diagnosis prior to admission. The incidence and predictors of heart failure hospitalizations among patients treated with percutaneous coronary intervention for acute coronary syndrome was assessed. It is a multi-center retrospective observational registry including consecutive patients treated with percutaneous coronary intervention for acute coronary syndrome. Patients with known history of HF or reduced left ventricular ejection fraction were excluded. Incidence of heart failure hospitalizations was the primary endpoint. The composite of heart failure hospitalization or cardiovascular death and cardiovascular and all-cause death were the secondary endpoints. Predictors of heart failure hospitalization and the impact of heart failure hospitalizations on cardiovascular and all-cause death were assessed by means of multivariable Cox proportional hazards model. A total of 14,699 patients were included. After 2.9 plus or minus 1.8 years, the incidence of heart failure hospitalization was 12.7%. Multivariable analysis identified age, diabetes, chronic kidney disease, previous myocardial infarction, atrial fibrillation, pulmonary disease, GRACE risk score greater than or equal to 141, peripheral artery disease, cardiogenic shock at admission, and LVEF less than or equal to 40% as independently associated with heart failure hospitalization. Complete revascularization was associated with the lower risk of heart failure. Heart failure hospitalization was associated with higher risk of cardiovascular and all-cause death. To conclude, incidence of heart failure hospitalizations among patients treated with percutaneous intervention for acute coronary syndrome is not negligible and is associated with detrimental impact on patients' prognosis. Several variables may help to assess the risk of heart failure after acute coronary syndrome.